This is Rick Mattson from the University of Washington Shoulder and Elbow Service. Let's talk about how to do a smooth and move procedure. The smooth and move is a fast, safe, inexpensive, conservative, and effective treatment for shoulders with symptomatic irreparable rotator cuff tears that have retained active elevation. On the left, we see an irreparable rotator cuff tear. There simply isn't enough tissue to reach from here to here. Here in a surgical case example, the humeral head is exposed, but the quality of the tissue and the quantity of the tissue is inadequate to bridge across the defect. Often patients that have irreparable cuff tears still have retained active elevation, that is, the ability to raise their arm up above the horizontal. The shoulder provides stability against upward directed loads using the coracoacromial arch. This is the arch comprised of the acromion, the coracoacromial ligament, and the coracoid process. And in the normal shoulder, the humeral head and the rotator cuff fit nicely beneath this arch so that when there's an upward directed load, the shoulder is stabilized in its center. Sometimes with age, a spur develops in this coracoacromial ligament, but because it's in the ligament, it doesn't encroach on the rotator cuff and continues to provide nice stability against upward directed loads. With aging, sometimes the rotator cuff gets thinner and allows the humeral head to move slightly upward. But as long as this coracoacromial arch is intact, the humeral head is stabilized against upward directed loads. In some cases, however, this stability is lost either because of wear of the acromion and the arch, or because of surgical acromioplasty, in which case these structures are sacrificed. In these situations, the humeral head can escape out from underneath the coracoacromial arch and give rise to what we call anterosuperior escape, as is shown here. We found that many patients with chronic irreparable rotator cuff tears can be improved by a straightforward rehabilitation program. Here's a case example of a 60-year-old man who was referred to us for a reverse total shoulder. At the time we first saw him, he had only 80 degrees of active elevation. In other words, he could not raise his arm level with the ground. However, after 2 months on an exercise program, particularly the strengthening program shown on the right, he had regained 150 degrees of active elevation and decided that surgery was not necessary. There are two sets of exercises that are useful in helping patients with chronic irreparable cuff tears. The first is stretching, because these patients will often have problems with shoulder stiffness. So we show these exercises that can be done at home, simple stretching exercises in flexion, in internal rotation, in abduction, and in external rotation. And daily practice of these exercises can be very effective in managing shoulder stiffness. And once the shoulder stiffness is resolved, the muscles that remain in the shoulder can act much more effectively. The second family of shoulder rehabilitative exercises are strengthening exercises. One of the most important is exercises in flexion, where the patient starts out pressing up with two hands toward the ceiling while lying down, initially starting with the two hands together, and then moving with the two hands apart, and then moving with a single hand, pressing up toward the roof, holding a small weight, and then as the shoulder gets stronger, weight can be added, and also the shoulder can be exercised in a progressively more vertical position until finally, as shown in E, the patient can raise the arm actively overhead in a standing position. We also emphasize internal rotations, strengthening exercises as shown here. And Here we emphasize shoulder protraction, where the shoulder blade muscles are put into effect, lifting the shoulder blade off the bed and helping propel the shoulder upward. And finally, we show here at the far right shoulder strengthening in external rotation. And even though some of the external rotator muscles may be partially torn, often there's still enough muscle remaining that it can be improved by using these gentle home exercises. Sometimes, however, patients with irreparable cuff tears do not respond to rehabilitation, and this can be for a number of reasons. One, a tuberosity can be prominent. Normally, the rotator cuff attaches to this tuberosity, but when the rotator cuff is no longer there, this tuberosity becomes a bump that can create roughness as the shoulder is abducted underneath the coracoacromial arch. The bursa that normally is in between the coracoacromial arch and the humeral head can get thick and again cause roughness in this area. The long head of the biceps tendon can subluxate out of its groove. It normally belongs over here, but with a cuff tear, it can slip and be in this location where it doesn't belong and where it can be painful. And finally, there can be problems with contracture of the capsule that normally lies beneath the shoulder that impairs motion of the joint. So the smooth and move is a procedure that is designed for shoulders that have rotator cuff tears that are not reparable. In other words, they can't be put back together surgically in a way that will last. And these shoulders also need to have retained active elevation. In other words, the patient needs to be able to raise the arm above the horizontal. The essential elements of this procedure are, first and foremost, to preserve the acromion and the coracoacromial arch, because this provides the necessary stability for the joint. Secondly, we want to preserve the smoothness of this interface between the humeral head and the coracoacromial arch, and this often requires removing bumps, removing scar tissue, and certainly if the patient has had previous surgery, removing suture that may be in this area. The biceps tendon is preserved unless it's frayed or subluxated. Because these shoulders often are stiff and the capsule becomes contracted, at the time of surgery, we'll do a gentle manipulation under anesthesia to regain full passive motion. And then finally, immediately after surgery, the patient is started on passive and active range of motion exercises. This procedure is performed with the patient in the relaxed beach chair position to allow full access to the arm. Because the whole goal of this procedure is to enable the patient to start using the arm immediately after surgery, we don't want to do any steps that will require protection of the shoulder or restrictions on the motions that are allowed. So for that reason, the incision is a nice cosmetic skin incision and skin lines, but the deltoid is split in line with its fibers so that it is not weakened in any way. By spreading open this deltoid split, we get full access to the rotator cuff, can see what the extent of the damage is, and can have full access to areas of potential roughness. We put a smooth retractor underneath this area to break up all the scar tissue in the infraspinous and supraspinatus fossa. We also inspect the cuff to make sure that we understand the full nature of the pathology and release any adhesions that may be forming in that area. These shoulders often have a lot of bursal hypertrophy, as shown here, often with adhesions between the bursa and the overlying deltoid and coracoacromial arch, particularly underneath the coracoid muscles, as is shown here. All these adhesions need to be cleared out. The tuberosity can become prominent, as we mentioned before. In other words, when the rotator cuff that normally attaches here is no longer there, this bump becomes prominent and needs to be smoothed out so that it doesn't catch as the arm is moved. When prior surgery has been conducted in an attempt to repair the rotator cuff, there'll often be prominent suture anchors, as shown here, and bits of suture that remain in that critical area between the coracoacromial arch and the humeral head, causing snapping and cracking and discomfort. Those need to be cleaned out. So at the end of the procedure, we manipulate the shoulder to gain a full range of motion, and then we repair the shoulder with a solid deltoid closure that does not require any kind of protection after surgery. And then we start immediate exercises, including flexion, abduction, and cross-body adduction. And it's important that these exercises be carried out right away after surgery to prevent the recurrence of scar tissue. So here's our stretching exercises in flexion, external rotation, internal rotation, up the back, and cross the body. We can also start strengthening exercises immediately after surgery. These are essentially the same exercises that we use to treat patients before surgery to optimize their strength. But now, because the stiffness and the roughness of the shoulder has been eliminated with the smooth and move surgery, these exercises can often be performed much more easily and much more effectively. So here's our strengthening program in flexion. We work on the scapular motors by showing scapular protraction, lifting the shoulder blade up off the bed. Also do shoulder shrugs, internal rotator strengthening, and external rotator strengthening. The smooth and move is a very effective procedure, even in cases where there has been a prior rotator cuff repair attempt. Here's a person who got back to calf roping after a smooth and move procedure. He had had 2 prior rotator cuff repair attempts, and his shoulder was essentially non-functional. At surgery, we removed all the scar tissue and the thread from the previous repairs and started him on a vigorous strengthening program after surgery, and you can see that he was able to return back to his activities of calf roping. It is important to recognize that he had this degree of function of his right shoulder in spite of the fact that at surgery there was absolutely no intact supraspinatus or infraspinatus tendon. So in his case, as in many, many others, the deltoid muscle and the remaining cuff muscles took over for the lack of these 2 very important muscles, but obviously they're not essential to this kind of function if the shoulder is properly managed surgically and rehabilitated. Here's another example of somebody who again had had 2 prior attempts at rotator cuff repair, each of which had failed, and this shows his function only 6 weeks after the smooth and move procedure. Again, at surgery, there was no supraspinatus or infraspinatus tendon. We've done a number of studies showing the value of the smooth and move using the simple shoulder test as a patient-reported outcome. So here are 40 patients that had a score of only 3 1/3 average prior to surgery and jumped up to over 5.5 after surgery as quickly as 6 weeks after their procedure. And it's important to recognize that many of the alternative methods for managing these irreparable cuff tears, such as a superior capsular reconstruction, require prolonged periods of restricted activity or even immobilization while waiting for the repair to heal. Here, there's nothing that needs to be protected, and the shoulder can get back to being used immediately after surgery. Here are 77 patients at an average of 7 years after surgery. You can see what their function was like before and what it was like after surgery. Here are the results of 74 patients, again at an average of 7 years after surgery. These are patients that had had previous attempts at rotator cuff repair. And again, we can see that at an average of 7 years after surgery, they had a dramatic improvement in their shoulder comfort and function as they assessed it. It's important to point out that in contrast to other approaches to this problem of irreparable cuff tear. We needed no expensive grafts. There was no postoperative downtime. We've had no infections and no revisions necessary after this procedure. So in conclusion, the Smooth and Move is a procedure for shoulders with irreparable cuff tears and retained active elevation, particularly those who have not responded to a preoperative rehabilitation program, including stretching and strengthening. The essential elements of this are to preserve the coracoacromial arch, to smooth the interface between this arch and the underlying humeral head, to preserve the biceps unless it's frayed or subluxated, to manipulate the shoulder to get rid of any capsular contracture, and to start rehabilitation immediately after surgery. It's a fast, safe, inexpensive, conservative, and effective treatment for shoulders with symptomatic irreparable rotator cuff tears in shoulders that have retained active elevation. Thank you.